Anyone facing spine surgery has probably asked the questions, how long will recovery take? And will I be able to move in the way I once did? It used to be the way to treat many spine problems was to fuse the vertebrae together in a spinal fusion surgery. But today, more surgeons are using something called motion preservation. It's a minimally invasive technique known as total disc replacement, which is reducing recovery time while preserving long term movement in the spine. It's a method that's becoming a lot more common. So, we wanted to dig in on the future of motion preservation. What does the future hold? And ultimately, how will it affect spinal fusions? Dr. Good joins us today. Dr. Christopher Good, spine surgeon and president of the Virginia Spine Institute. Dr. Good, thank you so much for being here and talking about this. I know this has been around for some time, motion preservation, but I'm curious, how long have you been doing this? And when did this kind of motion preservation technique first come on the scene?
Awesome. Yeah, thank you, Laura. I'm really excited to talk about this. I think it really is the future of what we're doing in spine surgery, and it's such a great option that is becoming available to our patients. The reality is disc replacement surgery has been around in one form or another throughout my entire career, right? I finished my training and started in my own practice in 2008. And even in my training, you would rarely see a disc replacement. It was a very rare surgery to be done. But at that point, it was mainly done with some early FDA experiments. It was a very rare thing. And at that point, there were still a lot of things that needed to be figured out in terms of replacing a disc. And by replacing a disc, what we mean is going in and removing a damaged disc, either in the neck or the low back, and then putting in an artificial device that still moves. So just like a hip replacement or a knee replacement, you cut out the damaged cartilage, you put in metal and plastic or some ulterior, alternative substance, and you keep movement at that level. And so while I was trained in this, even in my fellowship and my residency, it wasn't something we got to use regularly because these devices really needed a lot of improvement. And then there was a time period where they were using them a lot more in Europe, and they weren't really FDA approved here in the US, so they weren't available to us. And then there was a time period where they were approved, but no insurance companies would ever cover them in any way. And so it's really evolved over time to the point where now we're able to use these just in everyday practice. It's something I talk about and we do on a very regular basis. And so it's something that's, like many things, we take decades to evolve and make progress. And now we're really at the turning point where I think this is a tremendous value to lots of people, and it's out there in use all the time in our practice.
Yeah, and I know you've really pioneered some of this stuff too, and have been at the forefront of using motion preservation. How do you choose one over the other, meaning motion preservation versus spinal fusion in a patient?
I really think of motion preservation as a philosophy, not a procedure. Okay. Now, in the neck or in the low back, we have all these bones and discs connected together, and they all move, just like cars on a roller coaster, right? Each level has some movement. And that movement is inherently good. It's what allows us to bend and twist and turn. And as we go through our lives, life is a degenerative process. Things wear out, things happen, discs and joints can be damaged. Now, historically, if a joint got too bad or a disc, then the surgical treatment, which is still very common and helpful, is to fuse two levels together, which involves in some ways welding the two bones together using screws and rods or a cage. And that's a very beneficial treatment, but the downside is it does take away the movement at that one level. Now, you have all these discs in your low back, so if you take away the movement of one, if the others are still normal, people tend to do amazing, and that's a great treatment. But if you have multiple discs that are bad, or if you need to have lots of these levels fused together, we're essentially turning you from a roller coaster into an 18-wheeler, right? And the other concern about fusion is if you have one level that quits moving, whether that's because of arthritis and stiffness or because of a surgery fusion, if that one quits moving, the one next door starts to work a little bit more. And then the question is, how long does it last before it has that problem? Now, a big part of whether our discs wear out. It's, it's sad to say it, but there's genetics, and we have no control over our parents. There's luck, right? And then there's wear and tear, the things that we do to our bodies over time, whether that's choosing to smoke or carrying too much weight on our bodies or not maintaining fitness or doing dumb things. But that all plays a role. And so people who have one disc wear out, lots of times they have genetics where their other discs are at risk. And so anything we do now, we have to be looking down the road. And so motion preservation philosophy is saying, okay, if I do have to do something to someone, is there a good alternative that can preserve the movement here and at least look at preserving and maintaining movement at the rest of the spine down the road? And so, the old thing was, well, you got 3 bad discs, the surgeon might say, come in when you can't take it anymore and we'll fuse them. Well, now if I have a situation like that, it may be that one is so far gone it needs to be a minimally invasive fusion, but perhaps the next one could be a disc replacement, or one can be treated with regenerative medicine. And we're able to really look at each level, each segment of what's going on. And even if people do need multiple levels treated over time, ideally not end up with everything fused together for many patients. And so this whole philosophy of bringing in all these different technologies and regenerative medicine, stem cells, disc replacements, minimally invasive fusions, and applying that facilely, being able to take all these tools out of the toolbox is really the key, I think, in the future of procedural spine care, spine surgery.
Yeah, that's really interesting. So it's certainly case by case. It's customized, and it you don't see it. I mean, it sounds like, make sure I'm understanding this correctly. You don't necessarily see motion preservation eclipsing fusion because it's case by case.
Yeah, and if you look at where we're at right now, and we're going to keep getting better, uh, there are certain times when a disc is too far gone for a fusion. Excuse me, too far gone for a disc replacement. If somebody has a major instability or slippage between their bones, or they have a certain degree of nerve damage, there are times when a disc replacement is not going to make their life better. And so a common mistake that doctors and patients make is choosing the procedure they want to have or they want to do as opposed to the one they need to have or need to do, right? And so, I mean, I have a patient I'm very close with my whole career, and I want to do a disc replacement on him more than anything, but he has a lot of instability. And I just talked to him yesterday. We've known each other for years, and we decided a minimally invasive fusion procedure is a very predictable, successful operation. And doing something that will not work because of the anatomic problem, I mean, we're trying to make people's lives better, right? First and foremost. And so, um, fusions have also historically been done in ways that have lots of issues, very invasive, very hard to recover from, and fusions were done in a way that did not maintain alignment of the spine. And what we found with the studies is if you do a bad fusion now and leave the spine in bad alignment, there's up to a 10 times higher risk of rapid degeneration of the next one. And so what that means is if we do have to do a fusion, doing that in the right way can greatly decrease this whole concern of the next one going bad or how fast it is. And so I do fusions all the time. I clearly believe in them. But every time I'm looking at someone, I'm saying, okay, do I have to do surgery? Okay, if we do need to do surgery, right, can we avoid surgery? Can we use non-operative? Can we use regenerative medicine? If we need surgery, can we preserve the movement everywhere? If we can't, can we preserve the movement somewhere? And really having this whole like really detailed look through everything and talking to patients, it's a totally different mindset. And if you look at the results, especially for people who have multiple levels with problems, it's just such a different outcome for them compared to welding everything together surgically. And honestly, I talk about that like that's old school, but that's the standard of care. That's what's out there all around, right? That's what's happening now. And we're, I think, amongst a relatively small but growing group who are advocating for this thought process and utilizing these techniques. And I think that if you look at the field of spine surgery in 10 years, this is what everybody's going to be doing. And we'll be doing something else. But I think it's really cool.
Right, right. Yeah. No, you guys are You guys are definitely pioneers. But you talk about what's out there now, and looking back at when our parents were in need of spine surgery. I mean, how far we have come, and it's interesting. I think back to a story you told me about your dad, and a situation that he was in that really inspired you to get into this business in the first place. He had a full body cast. I know that really impacted you. Can you talk about that and like your thoughts on how far we have come with these procedures for spinal surgery and spine care?
Sure. I mean, the further back in time you look, the easier it is to see the progress, right? So you think like 1970s, when my dad fell and broke his back, they didn't have screws and rods and hooks. They didn't have a way to stabilize all these crushed bones around the spinal cord. So surgeon just went in there and put a bunch of ground up bone, laid it along the spine and put him in a body cast, hoping that if he laid still long enough, the bone would naturally all mend together and his spine would become stable. And that's that wasn't that long ago, right? And that's very, very barbaric, in comparison to what we're doing now, months on bed rest and body casts. And now, if you look at the advancements of being able to go in surgically and have the surgery be much safer and be able to get spine stabilized to get people out of bed immediately, same day after surgery, and get people moving. Not only do we get them to heal better and less invasively, but we get them back to their lives faster. We avoid all the complications that come from laying around. And with each kind of decade of advancement, we figure out, how do we make these implants safer? How do we avoid medical complications? How do we make the incisions smaller? And so, like that type of injury nowadays is lots of times treated with a few little small incisions, and people are out of bed the next day. And it really is awesome to see that kind of progress. I think that if you look at the future of getting to the point where we're not even doing surgery for these a lot of conditions, right? If you start talking about regenerative medicine and stem cells and gene therapy in the future, I mean, we're just scratching the surface, and it's going to continue to really explode as the progress proceeds.
I want to talk quickly about a lot of patients traveling overseas for disc replacement. What should they know? Number one, why are people traveling overseas so often for that? And what should they know about the procedures being formed here in the US?
Well, the main thing they should know is they don't have to do that anymore, and I'm thankful for that. Historically, you could get disc replacements. People would go to Germany, or that was a big one. But in the U.S., we didn't have disc replacements, so we couldn't offer them. And another big limitation was, they would go because maybe you needed more than one disc replacement put in, and then that was a big issue, not FDA approved or insurance. But the good news is, patients are now able to get the same types of treatments there, and in certain places, this is certainly not at every spine surgeon around, we're now working to do multiple disc replacements when it's best for a patient, or a replacement and a fusion together, and being able to help patients work through all that. And it does get complicated, and but it's worth the time. It's every patient we work through, we have to look at this. What's your situation? What will your insurance authorize? Like, how do we get you what you need? But it's certainly worth putting in the time. And what I think in general is, for most patients, if you look at the cost of going to do that in Germany or Europe and having all that done versus working through it here, we're finally to the place where you can get your treatment at home. You can get it for a similar or lesser amount of money out of your pocket, and then if God forbid you have problems or a recovery, you're also in the same country as your doctor, so that you can have easy access to those kind of things.
Yeah, yeah. Now, when people are, last question, considering back surgery, fusion, motion preservation, what should they ask their doctor? What are the questions that they need to consider?
Yeah, it's so hard. I recently had to get my dog a knee surgery, and I knew what surgery he needed, but I didn't know how to find the right person. And it was like, you'd kind of talk to people, and it's very hard, right? And to me, the way I thankfully got to choose mine was another veterinarian who I take care of was like, this person's the best. I vouch for them, right? When you talk to your doctor, you first, you have to feel like they care about you, and you guys could work together if something goes on. Like, if things don't go according to plan, you have to be with someone who's going to help you work through it. But when it comes to these discussions, it's hard because doctors are not good at saying, I don't know how to do that. And I don't know if that's our ego or what it is, but what I commonly hear from other patients is this surgeon says this can't be done. And there's a difference between this can't be done or this shouldn't be done and I can't do that, right? And and if a surgeon doesn't want to take on a complicated patient or a complicated surgery, it bothers me when I hear this can't be done. I'm like, well, then get them to somebody who specializes in complicated stuff. If I'm not the right person for you, I try and get you to the right person. And all the doctors who don't do disc replacements are quick to offer reasons why they don't work, the data isn't there, but if your doctor really honestly doesn't believe in disc replacements, then I think it's at least worth trying to make sure you talk to somebody who does believe in them and actually does them in their practice. And if it's not right for you, it's not right for you. But I will say the trend in our field right now, and it's a complicated set of reasons about why disc replacements are harder. They're more technically challenging. Sometimes if you have a contract with an insurance company, maybe they don't want you doing those, so you don't offer them. It's complicated. So I think at a bare minimum, making sure that your doctor has the tools in the toolbox and they're picking the right one for you is really important. And if someone just says, "Oh, they don't work," I'd say, "Well, maybe I want to talk to someone who thinks they work, and at least hear both sides of the story, and then make my best decision."
Yeah, goes back to that important piece of advice to get the second and possibly third opinion on something this important. Well, Dr. Good, thank you so much. Dr. Christopher Good, spine surgeon and president of the Virginia Spine Institute. Thank you so much for your enlightening information.
Thanks, Laura.